Hello and welcome to Ask the Oncologist. My name is Dr. Kpatsi. Most of my patients have had their relatives just look at them and think that they are going to be dying the next moment. People have had a lot of their family members, church members look at them with so much pity because they think that once they are given a diagnosis of cancer, they are going to be dying the next moment. Is this true? Now, my first answer is that it's no. Cancer is not a death sentence. There have been a lot of medical innovations, there have been a lot of developments. For example, there are new modalities of screening that has allowed us to be able to diagnose cancer at a very early stage. There have been a lot of innovation in terms of treatment options that allow people to be able to have very good outcomes from the treatments that they receive in terms of targeted therapy, modalities of radiotherapy, and there are very good ways of being able to follow up people after treatment. Now, in as much as cancer is a serious diagnosis, it is not a death sentence. I want to just enumerate on a few factors that can affect the outcome of any cancer diagnosis. One of them is the type of cancer. For example, most patients who are diagnosed with cancers like cervical cancer, breast cancer, and prostate cancer complete their treatment successfully most of the time when they are diagnosed very early, and they go on to be able to live their lives without having to worry about cancer. In as much as cancers such as pancreatic cancer still do not have very good outcomes, there are a lot of innovations that are ongoing, and we do expect a lot of breakthroughs in the near future. Another key factor that affects the outcomes in the management of cancer is the stage. For example, in breast cancer, we know that patients who have ductal carcinoma in situ, which is usually referred to as stage 0, have about 100% 5-year overall survival, whereas patients who are diagnosed with stage 1 breast cancer have a survival of about 98 to 100%. Whereas when the patients are diagnosed with stage 2 breast cancer, the survival is about 90 to 95%. As the stage gets to a stage 4, the survival goes down to about 30%. That's 5-year overall survival. So what you need to see, or what I want you to understand from this information, is that early diagnosis of cancer saves a lot of lives. Now, there's another key component that does affect the outcomes in the management of cancer. It also got to do with the overall health of the individual who is involved. For example, somebody who is fit is able to withstand the full components of the treatment that is involved in their diagnosis, and hence usually will have a very good outcome compared to somebody who is already dealing with a lot of medical comorbidities. So take a look at this graph by NCI. You can see that there are about 18 million people that are still alive with a diagnosis of cancer in the United States. This figure is projected to reach about 26 million by the year 2040. So you see, there are a lot of people who are still alive, who are able to get back to work, get back to their life, and continue their businesses with a diagnosis of cancer. Just like we have a lot of people who are living with a diagnosis of hypertension, diabetes, and many other medical diseases that you know about. So, a diagnosis of cancer is definitely not a death sentence. Yes. So what do I want you to take from this video? In as much as a diagnosis of cancer is serious, it is not a death sentence. And remember that early diagnosis, timely treatment saves a lot of lives. If you found this video useful, don't forget to like, share, comment, and share this video with a loved one. Share it on any platform and let people learn. Let people know that the diagnosis of cancer is definitely not a death sentence. Thank you very much, and see you in our next video.